All right. Good morning, everyone, and thank you for joining into our breakaway session. Thank you so much for joining into our breakaway session. I will introduce our speakers shortly. I just want to actually just remind people that if you go below the screen, you will see a couple of questions there directing you to if you want to ask questions or you want to type in the chat box. But if you type in the chat box, we won't be able to track some of the questions that you ask. So we'll only be able to track the questions if you actually click on the Q&A. That's when we'll be able to track your questions. And then the speaker, after presenting, then we can actually read out the questions and then we'll be able to respond to your question. And then just to introduce the speaker then, the speaker is Francisco Cornelius. He has 33 years of experience in child and youth care sector, working in various positions. He is currently the director of Leliebloem House. He managed different training programs for the NACCW and advocated and served in different committees for child services. Was the Free State chairperson for the NACCW for 3 years, and then was elected the national chairperson for the NACCW in 2006. And is now serving as the treasurer of the NACCW, and also on top of that, serving in the professional board for child and youth care workers. He holds a postgraduate diploma in child and family studies, religious studies, and various short courses. In all doing that, he still manages to find time to play his guitar and also go fishing from time to time. So thank you so much and welcome to you.
Thank you very much for the introduction, Kushe. And again, morning to everybody. It is wet and a little cold in Durban. It's almost like Cape Town weather, but it's fine. The mood is good, and we've got a conference. We've got a good conference going. I would like to start off this presentation by just a short introduction before I go to the slides. I haven't got a lot of slides, and I've invited my team because they're part of this whole discussion and this whole presentation. And that's the format that we'll be taking. It's going to be a discussion. And I'd like to start off by saying this past year has been the worst ever experience that anyone in our world may have experienced. It left many people dead, devastated, sick, without jobs, poor, and most of all, so confused about, something that even the scientists across the world are still trying to figure out. This COVID-19, this whole word COVID-19, in fact, has become real. It's not a word anymore. And if anyone else all over the world, if anyone is saying, hang on, we still have our doubts, well, unless you've experienced it, I'm sure you will have your doubts. And I respect that. In most of our families, in most of the poorer communities where people were infected and obviously directly affected, we might sing a different tune. It's almost like you were sitting on a boat and waves were tossing you around. You didn't know which way to go. There's a navigator there. And even though the compass is set for us to go in a specific direction, we were thrown off course, to use nautical terms. So I want to start off this presentation, and my team, I think they will just give a short name when they start talking. But I've got child and youth care workers, I've got my finance manager, I've got the education officer, I've got program coordinators, Richard, ADP, SBMP, I've got child and youth care workers, Miriam, Ruth, I've got the social workers, Hilda, and I've got Alison and Cindy. I've got the whole big team there that would like to feed into this discussion. So without any further delay, I'm going to start off. Hang on, oh my word, I've got the wrong presentation. Oh, I'm so sorry. Just give me a second. Let me get the right presentation up there. Right. My apologies. That's the presentation. So the title of it is, in a residential care program for children in need of care and protection facing a world health crisis. Do you react or respond? So there was this announcement in March, end of March of last year, and we found ourselves looking at each other, and the team are now going to start conversing. My first question was, what were your thoughts at the time? Just unmute and then we can just generally talk.
What is your experience?
So what were your thoughts at the time?
What do we expect?
What were you thinking when the news came through? The state president says, we are going to go down in lockdown level 5. How did you feel? Just how did you feel? What were your thoughts and how did you feel?
A lot of mixed emotions, fear of the unknown, because it was the first time that I experienced a thing like that. So fear really stepped in, or as I can say, yeah, we're not certain what is going to happen. What does it mean? Because it's just words.
Yes.
So we don't know the change that's going to happen.
Anyone else?
I also think one of the important things is just around the thought process was just around job security. What is it going to mean for me? Because my work really depends on me being out there. And with having level 5 out there, am I still going to have a job or not? And it became a reality almost of something that is way beyond my control.
Yes. Yeah. Yeah. Anyone else? So Sianda, what did you do?
What the colleague said. Again, I will just want to emphasize what my colleague said, but also
Just speak a little bit louder. We can't hear you.
Okay.
Yes.
The worry was about the schools. What will happen to our children? Because now we're going to start with the children, the total shutdown. What is there for them? What is the plan for the children? Well, now they will be with us for the next 3 months. That was March, April, May, June.
Yeah.
So it was
Miriam?
all that what my colleague already said.
Yes. Miriam, what did your family do when they heard this news?
My family.
Yes, your family. What did Cyril says lockdown? What did your family do?
We were in shock, a big shock.
Yes.
And I think as he always said, it was a big fear of unknown.
Yes.
Because we were not sure what is going to happen, and knowing that you have also old people in your house, what's going to happen with them. You just, every time you don't know. It's just a fear of unknown.
Yeah. Claudine? What did your colleagues do?
More likely for those who are over the age of 60, because many of us and many of the colleagues had their mothers and fathers and grannies staying with them. So not knowing how to support them. And if, for those who didn't stay with them, that was the biggest fear, because how are they going to get out to feed themselves if they are ill?
Absolutely. Yeah. Crazy stuff. Let's look at if we were to react, how was your reaction to daily news? I can tell you, I started switching the TV off. I didn't want to hear anything anymore. You know, people were going crazy, and I was just saying, hang on, this is depressing stuff. What were your thoughts on that?
I was actually, to be honest, I was actually sitting in front of the TV all day.
Yes.
Because of the unknown, as I said, but also to get more knowledge of really what is happening and what is going on. What is this that's now that the announcement? So getting all the information, but really that an impact psychologically, because of you hurting a lot of things And then
Yes.
you thought, oh, what is going to happen? Is the world now standing still? What is going to happen?
Yeah.
Because to be honest, I was expecting the next morning getting out, and then the soldiers or the police would have patrolled in the communities.
Yes.
That was my thought. But I was sitting there and waiting to get more knowledge and to see what.
Of course.
Around.
Yeah. And Richard,
And
I see your hand.
added with that, I think there was also, for me, there was a lot of confusion because I was channel serving between all the different channels. When I
Yes.
was key news, someone, a professor, somebody had his or her opinion on what is currently happening. You go to the next channel. So there was a lot of confusion out there. And at the same time, you had your participants who you're working with, as well as your colleagues and your family members, looking at you as a professional to actually give them a proper answer of what is happening. Yet you as the professional were just as confused.
Yes. Yeah. People were scared. I mean,
Yeah, definitely.
what happened about the shops? I mean, lockdown.
Oh, yes, we ran and bought everything. Buy toilet paper, unnecessary things, stock up. And it wasn't even necessary. But it was because of the news.
Right.
Watching the news and get that information.
Of course. And it was traumatic. Yeah. I mean,
Definitely.
that was the kind of reaction. You know, it was almost difficult to determine the children, however. There was a difference there. I think they were more confused. What would you say?
The children.
I think the children also, they were confused because they were not sure if they can go out or they not go out, what they need to do. Even the schools, they can't go to school, they can go maybe to bed,
Yeah.
stuff like that.
Yeah.
And you can imagine how confused they are if even adults were really confused.
Of course.
And
Yeah.
you think that the center become a prison for them. The home.
Yeah.
They can't go out, they must take their protection, you know.
Yeah.
So it was like prison, real prison. It was a stress also for them.
We are already dealing with a traumatic child, and here's the child, his whole routine gets now disrupted by this natural emergency which is out there. So yeah, definitely.
And
just
it
to
was
add
Albert
that
Einstein. Yeah. Carry on.
Yeah, even legislation that was confusing because
Correct.
we were waiting on that, and that actually made us confused because we had to take the lead, and then we couldn't because the legislation coming forth also confused everyone, and then we had to brought it down to the children, so it was the whole confusion. But I would say from the authorities that we were waiting on.
So as a team, we then chipped in. Albert Einstein says the following. He says, in the midst of every crisis lies great opportunity. And you remember what we did, because as Hilda was saying, we were waiting, and at the time we found ourselves just starting to do something. And my first response under the response was that child and youth care workers have a habit of responding to crisis situations. You remember what we did, eh? Huh? You remember as a team what we did? We immediately formed committees. Do you want to talk to that quickly?
Yes, we had a committee, but also you start from home the moment that you hear phoning us and getting the management on board in terms of this is what we have currently, so what are we going to do? So we start there, and then we came to work, and then we also had the committee here, and information then brought down those that we now knew about that information, but also in this crisis, doesn't matter what are we as a organization going to do.
And added to that, I think one of the responses that we took as a Southern Youth Care Center was to make sure that we as the professionals within the center, the adults here, it has to start with us. We have to make sure that we are okay, and we understand what is going on, and we need to take charge of the situation because we have young people, we have other people looking at us in terms of advice and the way forward. So we managed to get our feet grounded first.
Because you see, the regulations at the end of the day wasn't legible in some way. People didn't understand it, and we had to make it a little bit more easier for all of our colleagues around us, because there was doubt in the team. And I think that kind of response we took, and we found ourselves, you remember, we found ourselves ahead of what the department sent out, because at the time when the department sent their protocols, we had already done a lot in terms of our own protocols to understand and adapt in this new adjusted lifestyle. In the children's home itself, all of us were affected. I mean, you recall the behaviors that was experienced? The confusion, children being at home, child and youth care workers saying 24, now it's 24/7. Now it's not just a shift. You recall that? And some of us working from home and leaving them to their own devices. All of this had a serious impact on the lifestyle in the children's home. And the question was, how did we remedy this? We started off with the protocols. We started off by having regular meetings. Everyone was involved. We even had children involved in on that committee, on the protocol safety committee, right? And we asked for their input because it was important for us to say, at that level, they need to be able to understand what this means so that they can influence their mates on the ground. And the support that was available, we know we didn't have a lot of support from anywhere else. We had our board who supported us. But the most important people that we felt should have supported us was the Department of Social Development. And unfortunately, this didn't happen. At the time, managers got together and we then involved the newly elected Western Cape Commissioner for Children. And so that is how we moved on with this. We have to end off because I see there's not much time left, but I think the lessons learned from this and going forward would be, unless we involve everyone and not have one person, running the show, even the children who are affected, we won't get far. So one of the important things would be every single staff member should be involved. We know the financial impact it had till today on our organization. And there's like 50 children's homes in the Western Cape and elsewhere in the country. We can understand, because we're in the heart of this, that the financial impact this COVID brought about was devastating. I don't think we are going to get out of that hole, that financial rut soon. The other reality is we had funders who used to fund us, individual people who used to fund us, and all of that dried up. All of it dried up. We did get, however, a lot in terms of, and Claudine can attest to this, we got a lot in terms of donations in kind, but the kind of money, I mean, we made, and we're not shy to say this, we could only raise 84,000 Rand in the whole of the last financial year, which was unhealthy for any organization. So these are some of the stuff going forward. If we were to prepare ourselves for a crisis of this magnitude, we need to be properly prepared, but we need to have proactive measures in place. We need to have people understanding and constantly moving ahead of the times now, which means we actually need to create a group of people who can daily read and investigate where are we going in crisis times in an NGO, because this is specific to an NGO. Business is saying we had to close down. We can't close down. That is the other reality. The children's home will have to stay open. A lot of our children could only go home after a year. We know that. Now, that was traumatic in itself, but that is the kind of financial impact it also has, because now we've got to have children there every day, feed them every day, instead of having little breaks in between. You know what I mean? And it's not just about feeding them. This is about the whole organization being impacted in terms of transport, fuel, and everything else. So the message out there from me would be, have your whole team. Claudine, would you like to give a message from a financial point of view to our viewers out there?
Yeah, we just to make sure that you get all the support. It might not be easy for us to get that support that we used to have, but the support of your team and the support of your board and the broader community that can help in any way. We know that money is it's in a crisis as well. So wherever they can assist, please assist.
Hilda, from social work point of view?
Okay. I can also say the MDT team, but also that you need to focus on the children, the residents, on their feelings. And as you said, get them involved, if let them feel okay and look to their needs, but also to yourself in terms of if you're not okay, you can't work with the children, but also look at your feelings and how you're feeling and deal with that.
Miriam, from a childcare perspective, you had a lot of child and youth care workers out in trouble. So from a childcare worker perspective, what?
I think for me, what you need to be there all the time for your staff.
A little
Support them
louder.
as much as you need to support. As much as you need to support, but you need to be there for them all the time. Check on them in a daily basis, because you don't know when they will need you. But you need to be available for them. Listen to them and be there to support them.
Yeah. From education side, Sianda?
Again, the communication with the schools. We need more resources, especially computers and the data and all of that. Because now the teachers, they send the schoolwork more now using WhatsApp or email, because they can't allow people to walk in their schools because of this fear. So we do need more people like us here. We have our home assistant learning program that we established last year, and then we'll see the results of it, because now the children were kept, there's a class, they know it's a daily routine for them to spend 3-4 hours per day. So it was also working for us. You need your whole team, in and outside.
Yeah. Richard, closing.
I think lastly, I just want to say one of the most important things is that, yes, it was a national emergency and we had to respond to it. But one of the most important things that we've actually learned from it is that we were able to put care back into care work. And that was very important for us.
Yes.
Because now we could actually really get and sit down with our clients and do those one-on-ones really, because we actually had the time to actually do it. So that is one of the benefits that we had for them. And we were able to make sure that we don't allow anyone to fall through the cracks.
Yeah. Thank you very much, team. Is there anything you want to add in closing? Anyone? If not, I've put on the screen there contact details, and I'm handing back to the chair of the session. Thank you for the opportunity.
Thank you.
I'm going to stop the share.
Thank you so much, Francisco. Just a few greetings on the chats, but just to start off, I'll just to say thank you so much for this creative way of presenting, which is engaging and also very practical. And also like it talks about real life events and how people adjusted and readjusted themselves and their flexibility and the flexibility in the team. And also, the unity within the team came across quite well, and how people actually maneuvered and tried to actually fit in to the system, and working towards ensuring the safety of our children that we work with. Just a few greetings then from the chat is Mary Jean Cornelius is saying good morning, and Melissa as well. Sandy listens greetings, as well as Johanna. And then just to go then to some questions. One of the question is, can you speak to some of the protocol that you introduced as the center to ensure the safety and the well-being of the staff and children?
Yeah. I mean, protocol team. Richard, you're right there. Look, I think what was very important for us was to recognize, and Richard can follow on, and everyone else can follow on, because that is the team sitting there, the protocol team. The very first thing we needed to do was to understand what it means when they say you need to have PPEs, all right? And PPEs doesn't come cheap. And we had to resort to home remedies. Home remedies like vinegar, jig, lemon water, hot stuff, cleaning surfaces, washing hands. I mean, those were the simple stuff. But at the time when we were told, listen, these are the things that's going to help protect you, it didn't make sense. And yet, it's things that's supposed to be in place every day. You need to wash your hands regularly. You need to, when you cough, you need to be able to close your mouth and your nose when you cough. And we started there, and we had to explain to people in simple terms. When they say PPEs, it doesn't mean you have to put on this whole protective clothing thing and walk away. I mean, how can you can't afford these things, and then walk into the workplace. People are going to think you're from outer space. It was simple stuff that we had to put in, and that's how we documented it. And when the department came about with their whole thick document of protocols, we said, some of this doesn't even make sense. I mean, how can you isolate somebody in the center where you're working, for argument's sake? That was just one of the things that was in their document. And I said, it doesn't make sense. When you isolate, you need to isolate away from where you're going to infect and probably spread any disease in the workplace. So stay at home. And we had to document it. But it was simple, Johanna, it was simple stuff. Just putting down our thoughts first, and then, sort of spreading it out, and make sure that people understand what the protocols were.
Thank you so much for that response. Right. Thank you. And then Sandile is saying that it was very scary for children who are in conflict with the law and sentenced to secure centers. Some of them even escaped because no visitors were allowed.
Yeah. We saw in our children's home there, when we told the children, you can't go home, the parents didn't understand it. The parents came to the gate and said, but that's my child. I mean, how can I not visit my child? And we had to say to them, sorry, we can't allow people onto the premises. And they came to the gate and they had to stand there. It took a time for us to get, because, to get children to understand that you can at least speak to your parents. So what we normally do is every term, that is like every 8-9 weeks, we send children home for a weekend out. We couldn't do it. So this was at the end of March last year. So the next time our children went home was in October of last year. And then we sent a handful in December. You can imagine, that kind of trauma the children experience. But the mere fact that our parents couldn't understand it. I mean, what did we expect our children to understand? So I can imagine when they say insecure and children trying to escape. Luckily, we didn't have children escape anyway. But it meant that you had to deal with it in the moment, obviously.
Yeah. Thank you so much for that. And then Tigizwa sends greetings from Hout Bay, and then greets the whole team. And then,
thank you very much.
Yeah. And then Melissa as well is saying, well done to all the practitioners for staying resilient during this time. Thank you for sharing your your lived experiences, Francisco and team.
Thank you, Melissa. Is that Melissa all the way from Australia? One of our colleagues that used to work with us. Thank you for that. We appreciate it.
Thank you so much. And then I do have a question of my own. Looking at, we still have some time to hammer away at. I just wanted to find out from the team, because we know that, we had the hard lockdown, and then we had to adjust from level 3. We had to come back to level 5, and then we had to go back, level 3. Then we had to go to level 4, and then we had to come back again. There was a lot of change in the alert levels. And I just wanted to find out from the team, how did you adjust? Because each level came with different protocols and different regulations. So how did you adjust to all of those things, and how did the learners actually, the children actually experience that, all that up and down and fluctuation?
Yeah. Look, I think it was easier for the admin staff to work from home. So that was the easy part. It was very hard for staff now having to work frontline, the child and youth care workers who work a shift system. So in our case, our child and youth care workers come on duty on a Monday and they only leave on a Wednesday morning. Here was our very first concern. When they go home, how sure were we going to be that they were gonna stay in their own little spaces, basically in isolation, right? Until they come back to work on the Friday morning when the shift starts again. That was one of the biggest concerns we had. And we had to make peace with it, that we need to trust people. They're gonna go home, they're gonna be with their families. And then the alternative thing we had to do was, we had to implement a transporting system, because there was no ways that I was going to let anyone get on a taxi and come to work. We know what taxis are like.
Yeah.
And so that was one of the things that had a serious impact on our budget, obviously. The adjustment for children up till today is out of control. For the staff, it was hard when they had to come back to work, because what we then did was, we split the teams in two and we said, you work 1 week in and the other team comes back the following week. So that was under hard lockdown. So when they sort of relaxed the levels, one of the questions were, do people start traveling on their own and get into taxis, or do we continue? So obviously, I mean, it is a concern. We said, no. That will remain in place until we know this thing's under control. We know it's not under control still. So we have effectively now been transporting our staff for almost, well, more than a year, almost 2 years. But the effect it had on the staff was a disruption in their day-to-day activities. I mean, social workers could now not see child and youth care workers on a regular basis. Yeah. Because they would be in for 1 week and away for another week. So if a social worker like Yildiz there, we've got 2 social workers, so they both have 30 children. If they had scheduled appointments to see a child during that week, but that's the week that they are off, well, I'm talking about prior appointments, it now had to fall away. So you can then clearly see it was tough. The adjustment took a long time. I think now we are more or less, understanding that things should be better managed. But there's an improvement as we go along. We have our regular meetings still, and we constantly talk about it. So in response to that, I think we still have a long way to go. There is no resolve to anything yet. I see the team is back. They were lost for a while. But as long as we have lockdown levels under the new regulations, we're going to have to just adjust as we go along.
Okay. Thank you so much for that response. And it is quite helpful for me as well, because I think, flexibility is one of the key things that we always talk about in child and youth care. And yes, COVID has actually presented us the opportunity, to actually showcase how flexible we are, and that we are available in children's hours, and we will be available whenever they need us. And your response actually shows that, and the ability to adjust with times and making sure that you have the best interest of the staff and also of the children themselves. So then my question again then is around, the isolation, because, if we stay in a certain room and one child goes to school, and then in that class, a child had COVID, and then they have to come back now. And now, are you going to actually put the entire room or the entire block that the child is coming from under isolation? Or how do you normally manage that?
Okay, so it happened, right? We had an emergency placement with a couple of children. I think it was about 7 or 9 children over a weekend. And we weren't told that one of these children were taken to Red Cross Hospital prior to coming to us, and that they had tested positive. So this whole group of children comes in, and that was over the weekend. I think it was a Saturday. the Tuesday, one of those children had an appointment with the Red Cross Hospital for I think it was either their ears or their eyes. And when the child care worker, who's new now with this child, gets to the hospital, she gets told, this child tested positive last week. This child should not be here. That's why we delayed the operation. Now you can imagine the chaos then. Child comes back. The big question is, who was this child in touch with over the weekend? How many children were these children in touch with over the weekend? So, you know, children, you can't keep them locked up. You are looking for problems. And we then had to deal with that. Your question around, do you lock down the whole block, or what do you do? Is it just one child that isolates? And you know, every case is different. We have 10 to 12 children in a unit living in the same house. And our discussion around that was, we have to keep the children maybe just in the block because the space in the house is big. Keep them, you know, for a couple of days and test do the screening every day, test temperatures and so on, and keep them under lock and key and not let them come out. We also had to resort to let children come out at different intervals, you know.
Yeah.
So that was the one part. Then in June of last year, when the children were sent back to school, the very first day, one of the children comes back and is sick, and we take the child to the day hospital, and the following day we get the results. The child tested positive. Again, what do you do? This child was in contact with other children in the classroom. We don't even know how we got this thing, because he was okay when he went to school in the morning. So it's those kind of stuff. You have to actually deal with it on an individual basis. What we did, as I say, we were fortunate that we could lock down the whole block where that group of children are, but we're not going to lock down the entire children's home.
Okay. Thank you so much. The chats are buzzing. I think this presentation has been quite interesting for a lot of people, which is great. So Leonora, please, apologies for if I'm saying your name wrongly, but Leonora is saying that listening to this presentation brought back real memories. I take my hat off to the Leliebloem and all the NGOs who have done an amazing job in giving their best and doing their best. Your passion speaks volumes. I am proud to know of your establishment and a few of your staff.
Thank you very much. Thanks, Leonora.
And then Sipagamisiwe is saying this has been a hit. Even at homes, kids could not even play in the yard. It was a scary moment for everyone. This is very helpful. Thank you. And then Cayman is saying, thank you for the reality around these protocols, Sir Francisco and team, amazing work. And then on the question session, someone just said, keep flying the Leliebloem flag high, keep it up, team. So we basically have 2 minutes.
Thank you so much.
To respond to some of the comments, and then we'll close the session.
Right. I think from my side, I appreciate all the. I mean, I obviously can't see the chat, but I really do appreciate the questions. And I'm glad that we could assist in enlightening some people and also help them. The one thing that we didn't talk a lot about, you see Sihanda standing in the middle of the screen there. Sihanda is the education portfolio holder by us. And what we started was the HAL that he said, the Home Assisted Learning Program. And people asked us, so what is this? And it was a simple thing. We said, let's take the workbooks that the children have at school. Let's also take all the work that the children were given, because they would now come to school on a staggered program. Some of them actually go to school for a week, and others then after that, I stay at home for a week, sorry, and others 1 day in, 1 day out, 2 days in, 2 days out. We needed to come up with something. And we somehow wrote this simple program where we say, let's break up your day. And every single, and this is the one thing that I also need to stress, maybe some child and youth care centers and staff on, somewhere else can learn from this. Every single person in the block, from the finance person to the program coordinators, to the child and youth care workers, to the social workers, every single person were allocated a group of learners. So from the primary grades, grade R up, I think Sianda was a grade R up to grade 2, and then grade 4, and then the other grades split up like that until you get to the higher grades. We had one learner in matric last year, very difficult for us, very, very difficult, and obviously difficult for her. So what did we do? We then split them into groups and we put them all over the premises, in different lounges, in the hall, even in the office block. And we said, you will assist the learning, because none of us are experienced or qualified educators. None of us, right? We child and youth care workers, we social workers, we finance managers, we program managers. And so what we did was we said, let's help them to do the basics, like read, play, creative play that could help them count. So little simple math. And then obviously those who struggled with study subjects, we needed to find some way of helping them. And he had to download a lot of information and say, let's just go through this step by step. Obviously, a lot of children didn't do well at school. If they had passed, they were either promoted. If they had passed, they either scraped through. Our matric learner managed to pass, and well done to her. But she could have done better had she had other assistance as well. And that was the program that helped our learners, because my message to everyone was, we need to keep these children's brains going. We need to keep them cognitively active, because we're not educators. But that was the least we could do to help stimulate our children's understanding that they still have to learn, even though they're not at school, because none of us knew when the schools were going to be open when the first lockdown came. So that home assisted learning program, it's available. Sianda will share it with you. We will share it with anybody. It is a simple thing. And it's just the attitude of staff and the time committed to spend that moment with the child, even if it's 10 minutes a day, helping them to understand that school is still there. School, you might not be in school now, but the school hasn't gone away and your learning mustn't stop. And that was the basis of the home assisted learning. So thank you once again to everybody. I hope we've given you something to take with. Thanks for your support all over from where the messages came. It is really appreciated. Team, would you like to say thank you? Just unmute quickly. There's a thumbs up. There's a wave.
Okay, one last. Oh, there we go. Thank you.
Right.
Thank you so much, Francisco, and thank you to the team. And then one last comment then from Notolo, thanking you so much for such a great presentation. It reminds me of my daily work at the center we soldier on. Thank you so much to everyone who commented, and thank you for everyone who joined in and listened into the presentation. And thank you to the speakers, and thank you to the team who actually expressed and articulated very well some of the protocols and challenges that they had to come up with to address the COVID-19 situation that we were presented with. So we thank them, and we thank them for the work that they continue to do. On that note, we would like to close the session, and we can join the main session. Thank you so much.
Thank you. Thank you, everybody. Bye-bye. Keep safe.